All right, let's get started with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, good morning, everyone. Welcome to Gray Suit Day at the Shawnee County Commission. I am your host, Aaron Mays. I represent District 3. On my left is Commissioner Rippon, representing District 1. Commissioner Cook is not available today, and soon we will have our County Councilor, Rich Eckert, is also not here today, but Ashley Beegert will be filling in for him. And then our County Clerk, Lisa Schmidt, good morning to you as well. Let's go ahead and dive in. First item, please.
First item is presentations. A, State and County Mental Health Update. Kathy Mosier, Family Service and Guidance Center.
Good morning and welcome.
Good morning, Commissioners. Thank you for having us. And I'm actually not going to be giving the presentation today because I'm excited to have Kyle Kessler of our Association of Community Mental Health Centers for Kansas to help us with that today. So, Kyle?
Thank you, Kathy, and good morning, Mr. Chairman, Commissioner Rippon, and members of the public. I'm Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. We represent all 26 licensed mental health centers around the state and are active in our national associations as well, one of which being the National Association of County Behavioral Health and Developmental Disability Directors. Any organization where you have to take a breath in the middle of saying their name needs a new name. It's an affiliate of the National Association of Counties. I didn't think that I would be at a place in my career after being at our association for about a dozen years where I would speak at a National Association of Counties meeting before I spoke to my own county commission. Which must mean you all are doing a great job. So appreciate you. I'll make a few comments and then have questions. You have a packet that looks about like this that we provided with a lot of additional information about the state system and then even comparing that to Shawnee County. And clearly our county has a very storied history as it relates to mental health treatment. I would put it up not just against any county in the state of Kansas, but against any county in the country. When you look at the Menninger Clinic and Topeka State Hospital, at one point in time we had over 1,000 beds in Shawnee County for persons who needed inpatient treatment. And over time, we lost both of those. And what people lost track of with that was that it was a major pipeline for our workforce. At one point in time, a few years ago, I heard the statistic that nearly a third of psychiatrists in the country could trace their roots back to someone, either them receiving training at the Menninger Clinic or someone who they had been trained by or taught. So I think that's an incredible tree when you think about that kind of history. And so as time goes by, the need for inpatient treatment hasn't gone down, but a lot of it has been handled by community-based services and treatment. So I think that when you look at mental health reform in 1990, which that law was signed by Governor Hayden, and the move to deinstitutionalize, then shortly after that comes the closure of Topeka State Hospital, then the move in, I think, 1997, and I think at its largest number, it was approaching over 500 beds. Menninger got close to that, I think, a few times, and so then they left in the late 1990s, early 2000s, finally, and so we have really hemorrhaged in our workforce, and not just the medical side with psychiatry and nurses and nurse practitioners and physicians associates, but the clinical side with social workers and marriage and family therapists and psychologists and counselors. And so we're trying to recreate some of that around the state with what's referred to as a Behavioral Health Center of Excellence. We really see that. It started in South Central Kansas because there's a new mental health facility coming online down there. But as you all are probably aware, the Larned State Hospital and Osawatomie State Hospital are our only two inpatient state facilities currently. As of this morning, Osawatomie had a waiting list of over 30. That means that people who are a danger to themselves or others are on a waiting list and either being served by a community mental health center having someone watch them, or law enforcement, or emergency rooms at hospitals. So that's obviously unsustainable. So we see some fixes coming down the road, but certainly the support the Shawnee County Commission has given to both Vallejo and Family Service and Guidance Center over time with the crisis centers. That's an innovative and emerging piece of the treatment. The Crisis Recovery Center at Vallejo first, and now the Youth Recovery Center at Family Service and Guidance Center. So it won't be surprising to anyone to hear me say that it's never been a better time for those two storied organizations to look at a merger. I think that in the long term, and I'll kind of conclude my comments here in just a minute by referring to the legislation that was just passed at the federal level. And our association really works heavily on state public policy and finance, and some at the local and county level, but at the federal level, we're very, very active. And so our association has been in a strange position compared to some of our colleague associations around the country, especially Missouri, which has done so much to work on the issue of mental health treatment and policy. And so we want to replicate a lot of the things that they have done, because they were replicating a lot of where we were 25 years ago. And so I think the new legislation will be really painful for Missouri, but our association has had a difficult time in getting off of neutral with that, because we have not expanded Medicaid in our state, so we don't get hit nearly as badly. But where we do end up, and again, appreciating the contributions and support the Shawnee County Commission and other commissions around the state have given mental health and their community mental health centers towards especially the CCBHC model, which has taken root and has been in place for just a couple of years. The state did a study on that, had McKinsey and Associates do a study that showed that the investments and the costs of the CCBHC model are up about 40%, but the access to care is up by over 75%. We see that as a good return on investment to start with, and hopefully the costs up front will kind of diminish over time, and the access to care will grow even more as we have the workforce to help provide treatment services to people with mental health issues. So the final part of that is, as the federal legislation, our biggest concern is, as they look at consolidating the mental health block grant, the substance use disorder block grant, and a couple others, they were estimating $400 to $500 million in savings. That means cuts. We usually anticipate seeing 1.5% of those overall dollars. So if that still cuts $4 or $5 million from our system, then that again is something that we've explained to people hits the state or local governments unnecessarily. And so probably looking down the road, whether it's one-time opioid dollars or as you see some of that money come through, that's a good place to invest in community mental health centers, we believe as well, because now with the CCBHC model, every mental health center around the state is required to have a active addiction and treatment services and treatment process as well. And up until probably 8 or 9 years ago, only about half the mental health centers in the state had licensed addiction and treatment programs. So with that, I would stand for questions, and again, thank you for the time this morning.
Commissioner Rippon?
Has the state looked at expanding Larned and Osawatomie?
So yeah, Commissioner, it's a good question, and they have probably 9 years ago. Osawatomie was decertified because it's a very old hospital, in fact, built in the 1860s, and then they thought it was going to be big enough to serve the whole state, and when that didn't happen, that's when they built Topeka State, which I think came in 1872, and so the bones of Osawatomie State Hospital are 150 years old in terms of them being able to add on more buildings. I think they see the Wichita facility coming online being the relief valve for Osawatomie, because right now all the folks from Sedgwick County go to Osawatomie, and so once they have their own place there, then that will alleviate the inpatient issues at Osawatomie. Larned's also carrying a waiting list right now. Considering they cover most of the rural and frontier part of the state, I think it sits around 5 to 10 waiting list, but that's substantial for some of the law enforcement out there that only have maybe a couple of deputies or officers on duty at a given time. So that's a long answer to your simple question.
Kyle, thanks for being here. I feel like everybody has been sort of pointing fingers at other people, asking them for help, and, I've said a number of times, like, mental health is not a city problem, it's not a county problem, or a state problem, or a federal problem, it's everybody. We all have to do something about it. And so, here in Shawnee County, we've decided to build a mental health facility at our jail. Are there other communities doing anything like that to try and, scratch the surface of this?
Yeah, and I think it's one of the places, again, where Shawnee County was a leader in referring to the crisis center. I think the one at Vallejo was the second or third one in the state, and came on board really quickly after Rainbow Mental Health Facility, or RSI in Wyandotte County, as it's known. So that's probably the big one, but as far as mental health pods in jails, probably Shawnee County and Sedgwick County would be, and Johnson County would be the leaders in that area. And it wasn't very long ago where between Sheriff Easter and then Sheriff Denning in Johnson County, depending on who'd added beds more recently, they would refer to themselves as the largest mental health facility in the state. So I think that it's an innovative place. Certainly, Administrator Cole has done a great job in getting that going, and you all support's been crucial.
Okay, and it's interesting to hear that at one time Shawnee County had 1,000 mental health beds. Any idea what we have now?
I would suspect that number is in the 20 to 30 range. I think Stormont Vale West is probably the only game in town as it relates to that. And even how that history, and not to digress or take up additional time on your agenda, but the Department of Defense was the first group in the 1950s to approach Menninger to say, hey, how many psychiatrists can you put out each year? And I think Dr. Will Menninger said, oh yeah, we put out 6 to 8, and DOD said we'd like 100. And so then all of a sudden they amped that up, and then by the 1970s the DOD said, okay, we think we're good, we're not going to put as much money into this. And then they kind of moved it over to where Menninger was the programmatic staff or the residencies for psychiatrists at Topeka State Hospital. So they've always played on each other really well, and now they're both gone, and it's really a pain point, I think, for not just this county, but this area of the state.
Right. All right. Any other questions? No. All right, thank you.
Hey, thank you.
Appreciate it.
Thank you, Commissioner.
Okay, let's move on to our next agenda item.
All right, the next item is item 3, consent agenda.
We've got 5 items on the consent agenda today. If there's no questions or concerns, I'll move for approval.
I'll second.
Motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed, motion passes 2-0. Next item, please.
Item 4, new business. A, county clerk. 1, consider all voucher payments.
All right, our total vouchers for this time period is $4,229,212.41. Significant payments include $81,004 for Shawnee Mission Ford for 2 Ford trucks for solid waste paid from the 2025 Solid Waste Fund. $1,417,534.23 to KBS Constructors, Inc. for a monthly progress payment for the state-funded portion of the work on the mental health facility using state grant funding. $146,156 to B&T Construction for the final payments of the Levee Trail resurfacing project paid with federal grant funding. $79,755 to Southern Folger Contracting, Inc. for installation of 13 Folger devices under building and maintenance for the Department of Corrections. If there's no questions or comments, I'd move for approval of the vouchers.
And I will second. So we've got a motion by Commissioner Rippon, second by Commissioner Mays. Those in favor say aye. Opposed, motion passes 2-0. Next item, please.
2, consider correction orders.
I'll move for approval.
Second.
Motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed, motion passes 2-0. Before we move on, I did have a motion I needed to make, and I probably should have done this before the presentation, but And item E1, we have a resignation of the treasurer for Williamsport Township. I need to add an item E2 to that, and so I'll make a motion that we add E2, which would be the appointment of Kelby Robinson as the treasurer of Williamsport Township.
Second.
Okay, we've got a motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed, motion passes 2-0. Sorry about that, I should have done it earlier, but it occurred to me just a minute ago. So, all right.
All right,
We
next
good?
item.
Next item, please.
B, corrections. 1, consider approval of contract C 262-2025 with Family Service and Guidance Center and the Juvenile Detention Center to provide behavioral health and substance use consultations, assessments, and treatment services to the juvenile population, funded through state grant funds.
Good morning, Commissioners. Angela McCarty, Department of Corrections. Here today to ask approval for the contract between Family Service and Guidance Center and the Department of Corrections for the Juvenile Detention Center. This is for, to provide a behavioral health provider from Family Service to facilitate consultations, assessments, and treatment services for the juveniles. This contract is paid for through state grant funds. This is part of our House Bill 2021 mandated services through the state DOC. So I'll stand for any questions you have.
Any questions?
No.
Okay,
I would move for approval.
I'll second. Motion by Commissioner Rippon, second by Commissioner Mays. Those in favor say aye. Opposed, motion passes 2-0.
Thank you.
Thank you. Next item, please.
2, consider approval to purchase 26 ballistic vests for officers from 911 Custom with the most responsive bid of $36,695 to be paid from state grant funds.
Good morning, Commissioners. Steve Willis, Department of Corrections, Community Corrections. This is an effort to increase our safety procedures within community corrections. Our staff are in need of some equipment, and this gets us where we need to be for all staff while they are in the field, checking homes, work, doing what they need to do with the population that we serve. We have worked with the Kansas Department of Corrections and discussed these funds. They're available from our current fiscal year, which ends today, and that's due to us having not used all of our grant funds for other client services such as Oxford houses and incentives and things like that that just didn't get expended. So this is an opportunity for us to purchase necessary items for our staff with using state grant funds.
Okay, any questions?
No.
All right, I'll make a motion to approve.
I'll second.
Motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed, motion passes 2-0. Thank you. Next item, please.
C, Extension Office. 1, file Extension Council's 2026 budget.
Good morning, Commissioners. Candace Stiles, Director, Shawnee County Extension Office. And I've left at your place setting our certificate of proper functioning signed by Greg Hadley, the Director of Kansas State Extension. Per extension law, by July 15th in a meeting, you all have to recognize that we have filed our 2026 budget request, which we have done that with Audit Finance. But we are happy to participate in the budget process and be considered with all other departments, and we'll be back on July 7th for our hearing.
We are all very excited about that,
Thank
Candace.
you.
Do we need to take any action on this? All right, well, I appreciate it. Thank you.
All right, thank you.
Next item, please.
D, Parks and Recreation. 1, consider approval of contract C 263-2025, the Topeka Blues Society agreement for managing the entertainment for the July 4th Spirit of Kansas concerts throughout the day. There is no cost for this service.
Good morning, Commissioners. Tim Laurent, Parks and Recreation Department. So, yeah, we are asking for permission or your approval of this agreement with the Topeka Blues Society. This is just one of many events we have going on that day at Spirit of Kansas. We've got golf tournaments at Lake Shawnee and Cypress Ridge. We've got a car show and arts and crafts fair at the lake. And then the whole thing finishes up with the Capitol Federal Fireworks display at 10 o'clock that night. I'd be happy to answer any questions that you might have.
Questions for Tim?
None.
No?
I would move for approval.
I will second. Motion by Commissioner Rippon, second by Commissioner Mays. Those in favor say aye. Opposed? Motion passes 2-0. Next item, please.
Item 2, consider the request to fill the Marketing Communications Supervisor position at the Range 65, Step 5, based on the candidate's qualifications and experience. Compensation is $27.33 per hour, including benefits.
Tim Laurent, Parks and Recreation Department. Yes, we have our marketing communications position is vacant at the moment. We did conduct interviews, had several good candidates apply. We believe that this individual will be a great fit with us and will bring a lot of things to the department. This position manages our communications and public relations. They oversee a digital and print and media campaigns. They manage our social media. It's a pretty vital piece of our operation. So be happy to answer any questions.
Questions?
No.
All right, I'll move for approval.
Second.
Motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed? Motion passes 2-0.
Thank you.
Thank you. All right, next item, please.
E, Commission. 1, acknowledge the resignation of Bev Masters, Treasurer of Williamsport Township.
Okay, so the next two items obviously go together. We will take them up separately, though. But we did receive notice that Bev Masters has resigned from her position as the treasurer of Williamsport Township. So obviously want to thank Bev for her time in that office. But we need to, I will make a motion that we acknowledge the resignation.
Second.
Okay, motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed? Motion passes 2-0. Next item, please.
And that next item would be to appoint Kelly Robinson as the treasurer of the Williamsport Township.
Yeah, so typically our process, and I'll just kind of explain this, normally we would ask for applications for 2 weeks. In this situation, because of the revenue neutral rate deadlines that are approaching, Williamsport has asked us to not wait that time, and they have found somebody who is capable of taking this role immediately. And so their township board has asked us to appoint this person without the 2-week waiting period. So our legal team has looked into it and said that it's perfectly fine for us to do this. And so I will make a motion that we appoint Kelby Robinson to that position.
Second.
Motion by Commissioner Mays, second by Commissioner Rippon. Those in favor say aye. Opposed? Motion passes 2-0. Congratulations to Kelby. Next item, please.
I did not see anyone signed up for public comment.
I don't have anybody signed up.
The next item would be administrative communications.
Any administrative communications today? There's one.
It's holiday week.
Good morning, Commissioners. Bill Sutton, Shawnee County Solid Waste. Just like to remind the Commissioners and everybody else that this is a holiday week because we'll be celebrating the nation's birthday on Friday, July 4th. So our Wednesday, Thursday, and Friday customers are all scooting to the left, and tomorrow will be our double day. So, and also Saturday, we will not be having an HHW collection event because we skipped the month of July. So, thank you.
Okay, thank you. Everyone's favorite announcement.
I know. I heard the groan as I stood up. Good morning, Commissioners. Jennifer Sauer, Financial Administrator. Just a reminder that we have our departmental budget hearings coming up over the next 2 meeting times. On July 3rd, we are going to be hearing from the Law Enforcement Group, TARC, and our Recreation Group. And then on Monday, the 7th, we will be hearing from our Administrative Services Group, the Public Health Group, and Public Works. So, lots to look forward to.
I see lots of smiles in the crowd, so thank you. Anyone else? Commissioner Rippon?
I really don't have anything to add.
Okay. I don't either. So we'll be back here Thursday. Next item, please.
Next item, executive session.
We do not have a need for executive session today, so we are adjourned.